I've lived in Bowie all my life. I'm a tractor trailer driver. Back in 2011, I started talking like I am now, just in having sore throats, and it didn't go away. We made an appointment with an ENT, and he scoped me and told me I need to go to have this looked at right away. There was nothing he could do for me. He actually gave me my check back. And then I went to a hospital in Washington, D.C., and they did some tests there. Come to find out, yes, I did have throat cancer. They wanted to do radiation. It sort of worked at the time, but then it ended up coming back. Then they want to do a full laryngectomy. Well, come to find out, my aunt was eavesdropping on someone else's conversation and heard about GBMC.
He had radiation, but he had a recurrence. So he was offered total laryngectomy for salvage. So he went for a second opinion, and we evaluated George from every standpoint: his mental status, performance status, the stage of his disease. We looked at it, the extent of the lesion. Our speech language pathologists were very much involved here because we wanted to know, if we do this operation, can he swallow? He's a very lucky guy because he qualifies everything in the criteria for supracricoid laryngectomy. It's an organ preservation surgery.
The specific technique that this patient underwent enabled him to not have the full total laryngectomy. A total laryngectomy would require removal of the larynx.
I am very pleased I came here and had this surgery done, the supracricoid laryngectomy. It's perfect. I recommend it 100%. You can tell, look at me. I'm healthy, I feel good.
He's very lucky that it was just localized to that region. We were able to complete the surgery. It's a very demanding surgery, technically demanding surgery, and it's a precision surgery. Then our speech language pathology helped him to follow up in his re-swallowing.
He did have to work very hard after the surgery in rehabilitation to learn compensatory swallow strategies in order to protect his airway.
Life here now with this operation is basically 90% the same as it were before the operation. Coming here to GBMC is quite a bit of a drive, almost an hour drive with traffic and everything, but it is well worth coming here. I mean, the team is great.
When a patient comes to our center with a diagnosis of cancer, whether it's laryngeal cancer or any head and neck cancer, they're seen by the multidisciplinary team. They're seen by the dietitian, the speech pathologist, the social worker, and then we have an otolaryngology nurse specialist that also deals with the patient. And we work together very systematically as a team to carry these patients through from pre-treatment, during treatment, and then post-treatment.
They are specialized in what they do here. You cannot get a better care. You couldn't ask for a better hospital. The care you get here is extravagant.
The nature of this particular type of cancer and the fact that this patient was on the road to having a total laryngectomy and did not have to go that path is significant. The opportunity for him to have had this surgery by such a skilled surgeon such as Dr. Blanco is something that we all value here at the center because it does enable our patients to have the best possible functional outcomes.
If you have any kind of neck pains or any throat pains or anything, please try to come to the Milton Dance Head and Neck Center at GBMC. They are top shelf, 100%.